Hi, I'm Dr. Patricia Mills. I'm a holistic MD, women's health expert, and champion of wild women. And I'm coming to you live within my Facebook group, Wild Wisdom for Women with Dr. Patricia Mills, on my Thrive Thursday events. Every Thursday, I pick a topic that I think would be of benefit to you to really help you up-level your health and step into your highest health. I also sometimes have guests that I interview. And today, I'm really excited to talk to you about irritable bowel syndrome, or IBS. Now, this is a topic that is near and dear to my heart because I was once diagnosed with irritable bowel syndrome. And it was, I think I was in my early 20s. And I remember going into my doctor, my family doctor. She was a lovely woman. And I told her that I was having problems with my digestion. I noticed that I would get alternating constipation and diarrhea. And for me, it was cyclical, like it had to do with my menstrual cycle. And so she took a history and basically said, you have irritable bowel syndrome, and here's a laxative that you can take when you're constipated. And I was young at the time. I actually hadn't done medical school yet. So I was like, okay. And I went home and I started taking the laxatives, and over time, things got worse with my digestive system. Also, my hormone balancing just got worse and worse. My periods started really getting quite irregular. And it's only now, looking back on what I experienced and also hearing about what other women experience who have been told they have irritable bowel syndrome, and having that background in functional medicine. So I specialize in physical medicine and rehabilitation, but it was only when I did additional training in functional medicine that I put all of the pieces of the puzzle together. And now I can say I really do understand irritable bowel syndrome. And I want to explain it to you so that you can get a deeper understanding of it. Obviously, it's something that is hard to explain in a really short period of time, but I'm going to do my best to break it down for you, okay? So what we're going to cover today is we're going to go into what is and what isn't irritable bowel syndrome. What are the causes, like the most common root causes and some less common root causes of why people get it? And we're going to focus on women, but men can have it too. And what are 4 steps that you can start doing, that you can start really looking at and honing in on to really overcome this? Because women who have irritable bowel syndrome, it can be real suffering. I mean, your quality of life really changes when you're having issues with like constipation, diarrhea, or both, okay? So let's really dive into this, and please put in your questions if you're joining me live. Now, the diagnosis of irritable bowel syndrome is interesting because syndrome means that there isn't actually a diagnosis. So the difference between a diagnosis and a syndrome is a diagnosis implies that there is an understanding of what caused it, right? And what is going on, whereas a syndrome is like a constellation of symptoms, so many symptoms that can occur, and and they tend to occur frequently together, and there's like a number of reasons why it can occur. There's not one reason why it can occur, and so the doctor kind of recognizes these like sort of gatherings, grouping of symptoms, and we put a label on it because doctors love to put a label on it because that gives us a sense of like control, kind of like a feeling like, okay, like maybe this is something we understand a little bit better. And so the label is irritable bowel syndrome. Now, how do you make can you apply a label of irritable bowel syndrome to an individual? Well, there's the history. So a person comes in, and that they say, well, I'm suffering from constipation, or I'm suffering from diarrhea, or I'm suffering from both, like alternating constipation, diarrhea. Okay. And in order to say, okay, that's what you have, the doctor has to exclude a whole bunch of things that would be a diagnosis. So for example, the doctor needs to exclude that it's not celiac disease. So if it, do blood work for celiac disease, okay? The doctor needs to exclude that there's not cancer. So there's some red flags for cancer, and it would be like onset of dysfunction in the gut over the age of 50, or dark stools indicating blood loss, or unexplained weight loss, or associated night sweats, a family history of colon cancer, right? So the doctor might, will take this all into account and decide if they want to do some additional blood work, maybe a colonoscopy, depending on the age and the family history. And once you go through all these investigations and you say, okay, well, it's not celiac disease, it's not cancer, and then you say, okay, well, we're left with this like experience that you're having, this constellation of symptoms, and we're going to put a label on it, and we're going to call it irritable bowel syndrome. Now, the thing is that that doesn't tell you what is causing the irritable bowel syndrome, right? So for you to have a label of irritable bowel syndrome, you need to have the gut dysfunction of constipation and diarrhea, and you can't have been diagnosed with something like that you would detect on blood work or imaging, like the celiac and the colonoscopy for cancer, for example, right? Okay. So let's say you're someone who's been diagnosed with irritable bowel syndrome and you're wondering, well, what is causing this, right? Because when you look at the research and it's like, the treatments, which we'll get into, there's like non-pharmacological, like non-drug, and then there's drug treatments, and the drug treatments are targeted at, like, if it's diarrhea, it's like targeted at like drying you up and constipating you more. And if it's constipation, it's like a laxative to make the bowel movements move more, but it doesn't, that's a Band-Aid, which is sometimes necessary. However, it doesn't get at the root cause, right? You are not deficient in laxatives. You are not having a problem with like water regulation where too much water is being dumped into your bowel. And if that's the case, like why? The question of why has not yet been answered. So I'm going to go through various root causes and just think to yourself as you're listening to this, could this be me? Is this something that could have happened to me in the past and now I'm suffering the effects of it? Is it something that's still ongoing, like a perpetuating thing? So was there a trigger? And then is there a perpetuator? So think to yourself, okay? First, we're going to focus, there's two big categories, okay? So one big category is things that happen in the gut, like at the level of the gut. And the second big category is things that happen that affect the gut-brain connection. So things that happen to the brain that affect the way it communicates with the gut, and then it affects gut function indirectly, okay? So first, let's hone in on the gut, the direct, like anything that's directly affecting the gut, okay? And in order to do that, you kind of need to understand a little bit of the anatomy of the gut. And the irritable bowel syndrome typically happens at the level of like the small intestine and the large intestine. So after the stomach, when the food gets dumped into the small intestine and then it goes up into the large intestine and then down into the rectum and you poop it out, it's usually within that range, although you can have disorders of the stomach that cause this to happen. So it gets complex, but I'm going to try to really get it get it down to try to make it less complex. So in the gut, you have the lining of the gut. Okay, and the lining of the gut is like a coffee filter. It needs to allow certain food that has been broken down into like a fine like fluid to get through, but the food that hasn't been broken down and all of the other crud that gets into the gut to stay in the gut and be pooped out and not get into the body. So just like the coffee grinds, you don't want to get through the coffee filter, but you want the coffee to get through, okay? So what happens is that we have the lining of the gut, and on top of the lining of the gut that keeps the lining of the gut healthy, we have a thick mucus layer, and on that mucus layer, we have what's called our microbiome. So let me know if you've ever heard about the microbiome in the chat, if you're joining in live. And the microbiome is a community of organisms that are meant to be living within us. They're like the buddies in our belly, okay? And what you want is they're a community, and you want a healthy community to be there. And the healthy community, their job is to maintain that protective layer of mucus in the gut. They feed off of it actually as well. So it's kind of like this interaction that we feed them, they feed us. They take in our food, like they are the ones who take in fiber. They eat the fiber, and what they poop out is like super fuel or ketones, and that gets into our body and feeds us. They also take in things like the polyphenols or the nutrients from plants that give the plants color, like the blue color, the green color. They eat those color-giving nutrients, and they poop out things like B vitamins and K2 vitamins. And again, we absorb that. So they actually make our fuel. They break down foods that we cannot break down, and that breakdown that they do then feeds us. So we have this beautiful relationship with them, okay? So what happens is if something gets into the gut, to hurt either the microbiome or to disrupt the mucus layer in the gut with that protective mucus layer, or actually damage the lining of the gut itself. So kind of like three things, three kind of layers of protection, then that's going to start disrupting the function of the gut. Okay. And so you can get everything from like what's called small intestinal bacterial overgrowth, where the bad guys are now proliferating in the microbiome. So instead of the good guys, you got the bad guys. You can get bloating, you can get gas, you can get distension of the belly, along with the constipation and diarrhea. Okay. And you can have, with the harming of the mucus layer and the harming of the lining of the gut, now that coffee filter is ripped, if the gut is leaky, it's called increased intestinal permeability. And now the crud, like the coffee grinds, which are supposed to stay out of the body, they're now getting through. So what are those coffee grinds in our gut? They are composed of undigested foods that are not supposed to be getting into your body. Okay, so like protein, like gluten, that's supposed to be digested down into its basic building blocks, doesn't get digested down, and then it can get into that leaky gut and activate all sorts of food sensitivities. But any protein, like some people, when it gets really bad, they start reacting to like bananas and kiwis and oats, that kind of stuff. Okay, so if you have a lot of food sensitivities that are developing, that's a sign of a leaky gut. Okay. Other things that can get in that are not supposed to get in is the microbiome itself. Like, we're not supposed to get these organisms, the bacteria, the viruses, the fungi, the parasites getting into our body. And there's clear evidence that when you have a leaky gut, these organisms get in and they can spread through the body and cause other symptoms. So people with irritable bowel syndrome, at first, it seems to be just a gut problem, but over time, we start to experience like problems with mental clarity, problems with hormonal balance. It can even get like joint pains. You can get skin rashes. All of these other things start building up, and they seem unrelated to irritable bowel syndrome, but the root cause is the same. Okay. And so and then the other thing is that in the lining of the gut is the nervous system that causes the contraction of the gut muscles. So in order for the poo to move, that bowel needs to contract. And if you start to damage the lining of the gut, you start to damage that nervous system that's there causing the bowels to contract to get the poo out. Then you're going to start to get what's called problems with motility, like lack of movement. And that's when you start to get a bit of the constipation. Okay. And then what can also happen is that the immune system, our immune system actually has headquarters in the lining of the gut, because that's where a lot of the foreign invaders come into our bodies through what we eat and drink. In the past, it was like you would be in nature picking up food, to put in your mouth, like a mushroom or something. And if it was not good for you, or if it came with mold or bacteria, the immune system had to be ready in the lining of the gut to fight it off. What happens is that if that lining of the gut is damaged, if the headquarters of the immune system are damaged, and for the medical people out there, it's the Peyer's patches, P-E-Y-E-R''E-S, the Peyer's patches, they get damaged, you can actually start having dysfunction of the immune system, okay? So the immune system now is not able to be there appropriately to recognize friend from foe. So again, things start to get in that shouldn't. And when you have those bacteria coming into your body and you have the undigested protein coming into your body through that leaky gut, the immune system in your body gets triggered like, oh my gosh, all of these foreign invaders are coming in here. They're not supposed to be inside of us. And they start to like get into attack mode. And some people with irritable bowel syndrome can develop autoimmunity diseases. So Hashimoto's thyroiditis, Crohn's disease, ulcerative colitis, rheumatoid arthritis, a whole constellation of autoimmune conditions, multiple sclerosis, for example. And there's even some conditions that are starting to be realized that it's autoimmune conditions that we didn't even know it was related to autoimmunity. Okay, so we're kind of learning more about that as we speak in the research. So you can see that irritable bowel syndrome can be a spectrum. Some people can get it mildly, some people can get it moderately, some people severely, and then you can go on to additionally develop other issues over time. And you would never like link the two, but it's more like irritable bowel syndrome is like the initial stages of things that are going on. So if you have irritable bowel syndrome, it's really important to really get on top of that, okay? The other reason is that we have a lot of hormones that are produced in our gut at the level of the lining of the gut. And when that lining of the gut is disrupted and the microbiome is disrupted, because the microbiome helps the production of hormones, you start to get hormone imbalances. So you start to experience hormone imbalances in other parts of the body, and it can affect even like your mood, you can cause irritability, depression, you can get these differences in like sex hormones because you start to get inflammation in the gut, and the inflammation can cause inflammation in other body parts. It's a very complex interconnected system. I just want you to understand that it all starts at the level of the gut, and then it can start to have like ripple effects through the body. And I hope that makes sense. Put any comments in the chat if any questions have come up so far, okay? All right, so now it's like, okay, well, what is damaging the gut? Well, okay, it's pretty much a lot of things that we're putting in our mouth. So it's improperly prepared foods. Like I talked a lot about anti-nutrients and the power of plants and how we have to harness it safely. So you know, if you're doing grains or nuts or seeds or legumes or beans, ancient wisdom and the research is backing this up, requires the proper preparation to be soaking, sprouting, fermenting in order to deactivate those anti-nutrients that can harm the lining of the gut and cause that soul erosion of the gut lining and dysfunction of the gut lining, okay? The other more common reason though is processed foods. What we're discovering is that processed foods and the artificial additives, preservatives, things like gums, emulsifiers, those actually damage the microbiome and the lining of the gut and cause inflammation of the lining of the gut. And that can cause damage, and that can cause irritable bowel syndrome. And that's I would say that's probably one of the number one things that we're doing to our gut is by ingesting processed foods. And it's always amazing to me how I'll be working with some clients and we'll be getting deeper and deeper into their diet. And they'll be like, oh, and what about this? Like these sesame snaps, you know, I eat them all the time. They must be healthy because they're sesame. And we look at it and it has a ton of sugar in it. Well, guess what? Sugar feeds the fungus in your gut, and you're supposed to have candida in your gut, but you're not supposed to have it overwhelming the system. And when you have candidiasis, like a lot of candida around, that can really cause problems in gut function, diarrhea, constipation, that sort of thing, okay? So one thing I've really done for my health is I've really, really cut out processed foods, all right? Now, there are a few processed foods that I've approved, so to speak, for my own diet. So I'll be creating a Dr. Patricia's approved list of processed foods, and I'll be sharing that with you. However, that list is like, there's like, you know, right now there's like 7 items on it. All right. So you have to be very, very mindful of that. And reading ingredient lists is key. The other thing that can really harm our microbiome is pesticides. So any food that is heavily sprayed can harm the microbiome because it's pesticides kill organisms, and the microbiome are organisms. Little did they know when they created pesticides that they would inadvertently be causing damage to our gut function. Okay, so there's a lot of issues with irritable bowel syndrome. It's like one of the top presenting causes for gastroenterology assessments in like when they do subgroup analysis. So, and about at least 20% of the population is affected by it. It's a lot of people, right? So that's the problem. Now, the thing is that, so what I do is I choose to eat organic foods just as a matter of like health promotion and disease prevention. If you find that you can't do that very well, what you want to do is you want to go to the ewg.org, look at the Clean 15 and the Dirty Dozen list of foods, and you avoid the Dirty Dozen, and the Clean 15, you don't have to buy organic necessarily. Okay, so it's like harm reduction. You know, we're doing our best with what we can do. Okay. The other thing that can harm that lining of the gut are drugs. And for women, a big one is oral contraceptives, all right? Unfortunately, the non-bioidentical hormones in oral contraceptives are again, not bioidentical. They're not identical to our own hormones. And research is showing that they are causing problems at the level of the lining of the gut, problems with the microbiome, and that's having downstream effects on our body, like depletion of our nutrients, imbalancing of our hormones. It stops the communication between the brain and the ovaries, really interferes with that communication. So, you know, I was on oral contraceptive pills for a while. I had to heal myself from being on them. And I'm really looking forward to the day when we have a better solution for women having the freedom to choose when they do or don't want to get pregnant that doesn't involve all of these other downstream effects that we unknowingly were kind of signing up for. And the thing is that our doctors don't know. So, you know, I don't hold it against them that they're prescribing this like candy sometimes for women's hormonal issues. However, it's not the right way to go. We are going to have to find a new way. Okay. It's just unfortunate. That's the truth and the reality. Other drugs that can be causing problems are things like anti-inflammatory medications like ibuprofen, NSAIDs. They really do damage the lining of the gut, including the microbiome. So I just, I don't use them at all. I have other ways to manage my pain if and when they should occur. But when you heal your gut, the inflammation goes down and you're less likely to experience problems with pain. So it's kind of like a positive cycle when you start to get out of it, which is really great. And there's other medications, like some antidepressants can do it. And what they're finding now is that a lot of medications, when we study its effect on the microbiome, unfortunately, there are effects, okay? Very few medications that are studied on that level of look at the medication interaction with the microbiome are finding that there's no effect. So I am as a holistic MD, I try to help women, achieve their highest health without the use of medications. That's my approach. I do recognize that there are often the need for medications as to give you relief from how poorly you're feeling so that you can then get the energy to heal yourself, to heal the root causes. I find it shouldn't be the place where we stop. It's the bridge to get to where we need to continue. That's my perspective on medications, my philosophy, okay? So they're not good, they're not bad. It's just how do we use them? How long do we use them for? And where do they fit into the paradigm of holistic healing, right? Now, so we've talked about things that can damage the lining of the gut. Now we need to talk about what is the gut-brain interaction, okay? Now this is really, really interesting. So the gut and the brain are directly connected through the nervous system, okay? So there's actually a nervous tissue that connects the gut to the brain. And so when we're in utero, in our mama's bellies, and that we're a ball of our nervous tissue, the ball of cells that are to form our nervous tissue, the nervous system tissue, they separate into two. One goes into the gut and lines the gut, and the other one goes into the brain and forms the brain. And the bridge between them that is connected is the vagus nerve, VAGUS. So we have the brain and the gut connected by the vagus nerve, and the nervous system in the gut is as complex as the nervous system in the brain. So the gut is your second brain is actually true. However, the function of the gut is different. The gut's function is not to create speech or to do mathematics. The function of the gut is to analyze what's coming into the environment and react accordingly, give the gut motility. And we're still discovering what else it does because it is so complex. Like it must do so many things we're not aware of. And what happens is that research shows that when we have emotional or physical stress at the level of the gut, that has impact through the vagus nerve on the functioning of the nervous system in the gut. So the brain impacts the gut. So what do I mean by emotional stress? Well, if you have a lot of things happening in your life to trigger stress, and you don't have lots of tools in your tool belt and how to cope with stress, how to take that trigger and change it to one of stress inducing to one of like expansion and growth and looking for the opportunity and the challenge, then you're gonna get the physical effects of stress, which is the activation of the stress aspect, the stress response of the nervous system, which then activates the stress response in the gut. And at the level of the lining of the gut, that actually can cause a leaky gut. So emotional stress can actually cause a leaky gut, which is why for some people, when they go through like a hugely stressful life event, like the death of a loved one, or an accident, or being fired from work, or financial disaster, they start to experience poor health after that. And one of the reasons is that gut-brain connection. Very powerful. Like I cannot stress that enough. It's very interesting, right? And then there's the physical stress, which is like a concussion or a brain injury, or like, let's say, drug use that, impacts the brain function. And we actually know for a fact that after a concussion or brain injury, you can get a leaky gut as well, which is really fascinating, okay? And again, when I specialize in physical medicine rehabilitation, and I was seeing people post-concussion, post-trauma, and I didn't know at the time this whole holistic view of health and the body and the mind-body connection. And I didn't put the pieces together that these people were really suffering from all of these other things. And when they would tell me about it, because I didn't see the connection between their body and their brain in that way, I was like, well, I don't know, that's really unfortunate. And I wasn't trained in how to fix it, right? So anyways, this is one of the things I'm doing, is really trying to help people raise awareness around this, right? So in order to, and sometimes you need to treat the gut and the brain at the same time. So yes, you've got a brain injury and a concussion, and we need to go in and heal the gut too, right? We need to protect the body. So I've covered a lot of the, so when people say, oh, like, oh, IBS is in your mind, well, it's like, that's partially correct. Yes, the emotional stress is in your mind. However, it actually has physical effects on your body, right? So there is that mind-body connection, and the research is very clear with that. So then we're getting to a point of, it's like, okay, Dr. Patricia, you've convinced me, I understand, everything is clear as mud. And if it is clear as mud, please put in the comments. Now is the time, if you're watching me live, to start writing in your questions, okay? Because there's a bit of a delay between me presenting and me seeing what's going on in the comments. So please go ahead and put in your comments now, questions now if you have any. But what you do is, there's 4 major areas that you want to target when you're talking about, recovering from something like irritable bowel syndrome, all right? So first is like, first you need to look at, we're going to go sort of like least invasive to more invasive. So first is like the stress part, because when you're suffering from irritable bowel syndrome, even if stress wasn't the trigger, it eventually becomes a part of the picture, right? Because it's stressful to have irritable bowel syndrome. And so you have to be, and so you can actually make your IBS worse by getting stressed out about your IBS, right? So what you want to do is you want to really look at things like to reduce the stress in your life. And it's not remove. So first of all, you need to detoxify from your life things that no longer serve you. Be very radically honest. Like, what do I have in my life? It's like when you're decluttering your home, like, yeah, okay, I could say that I need all of these things, but do I really need these things? And what can I let go of? Same thing in your life. Is there a toxic person, toxic job, a toxic activity, a toxic habit, right? What can you let go of? Okay. And then you're left with all the things that you need. And it's like, those things will be causing you stress. Like, you can't let go of your kids, you can't let go of your job necessarily all the time. So it's like, your partner's there, and you have to learn how to, manage certain stressful situations. And it's like, okay, what are you going to have in your toolbox? Well, here's some examples. What I use is I meditate every day, every morning. I wake up early. I have 2 kids, age 4 and 6 right now. And I still make the time to wake up and meditate. It's like my drug. Okay. It's my stress reducing drug. Breath work, really powerful to calm the nervous system. There's a direct link between our breath and our brain, and it calms it down. Okay. For some people, it's like engaging in play. So dancing, singing, putting on fun music, getting out for a walk in nature, right? Turning off your phone, closing your laptop and disconnecting for a while. And there's a dose of like 10 minutes twice a day that I recommend to you that you try to hit every day, of either relaxation or play or creativity. So doing something for no purpose other than creating, drawing, music, put that into your day. It's so powerful. Okay, cannot be underestimated. The second thing you want to address is your nutrition. Nutrition is key. And someone asked me, well, what is the diet for irritable bowel syndrome? Well, remember, there's all of these different causes. And if you have leaky gut, probably what you were eating while you had a leaky gut, your body's reacting to. So it depends on what you've been eating while you had a leaky gut. And sometimes you do have to completely change your diet, give your gut a break as you heal your gut. And I'll tell you how to heal your gut. That'll be the next part, the supplements. But you do need to do what I call a personalized diet. And I actually am in the process of creating a personalized diet workbook. Reach out to me if you would want to be put on the wait list for that. And it takes you through how to personalize your diet. Okay. And there's a process to discovering what doesn't serve you now, giving your body a break from it so that it can heal itself. And then reintroducing foods to see what can it tolerate now. And then I would recommend doing this thing, every, 6 months to once a year, to discover what is your body now able to accept versus not accept. And it just depends on how much was your body able to recover from the leaky gut and from the food sensitivity, the reactions to the food getting in past the lining of the gut. Okay. So, but the big offenders are sugar, processed foods, vegetable seed oils like canola, sunflower, soybean, corn oil, and non-organic corn, non-organic soy, and eggs, because they're complex proteins. So some people tend to really react to that. And obviously gluten. Gluten is a big offender. I'll be talking about gluten separately because I don't believe that it's like gluten is a problem. I think it's a problem with the breakdown of the gluten and getting past that leaky gut. If we can properly digest our food, and the leaky gut, the gut is intact, and it doesn't, that gluten doesn't come with pesticides. Wheat is a heavily sprayed crop, right? And if the wheat is properly sprouted or fermented or soaked, okay, that magic combination could mean that you don't develop problems with gluten. So like Ezekiel bread is a lovely, organic, no additives, no preservatives, sprouted grain whole bread. So if you don't have celiac and you want to see if you can do well with that kind of gluten, that's the kind of gluten that I eat. And that's because I don't have celiac disease. I can maintain that in my diet, but I do avoid all other kinds of wheat as much as I can. Okay. Now, then the third one is the targeted supplements. There's a whole list of supplements that you can do, but just so you know, my big go-tos are magnesium and zinc and vitamin C and vitamin D. Okay, so those are the four. And if you go into my Facebook group, Wild Wisdom for Women, or if you look down in the captions for the free ebook, How to Naturally Rebalance Your Hormones, I describe how to up your magnesium levels. Okay, and it's a personalized thing. It's to bowel tolerance. So your body will tell you when you've had enough. I always recommend powdered magnesium rather than the pill form. Okay, and I also have a recommendation for that. And zinc, 20 milligrams a day is safe. Going above that can decrease your copper levels too low. Very healing for the gut. Vitamin D, about 2,000 international units a day. And when you buy the one that comes with vitamin K2, so D3 and K2 is often balanced, and the K2 and the D and D3 do very well together. And the vitamin C, 1 gram to 2 grams a day in divided doses, 1 gram in the morning, 1 gram at night. All right. And you want the buffered vitamin C, not the citric acid or ascorbic acid, but the ascorbate, which is less acidic and more calming for your gut. And the last one that I'll mention is movement. So when we strategically move, it helps the bowel movements to go. And so research shows that if you're someone who's under moving, you want to move more, and kind of like even getting on that rebounder, the mini trampoline, and bouncing around, that can help actually promote some good bowel movements if you're someone who doesn't like to go to the gym. And if you're over moving, you might be overly stressing your body, and that's creating stress in your body. And that's going to cause a problem with that gut-brain connection. And that can cause leaky gut too, just from over exercising. So if you're like really massively exercising every day and you're not paying attention to your energetic ebbs and flows, and if you're menstruating, noticing those ebbs and flows, if you're menopausal, noticing those ebbs and flows and respecting them, you need time for recuperation and rejuvenation and repair. And if you're over exercising a lot, you're not giving yourself that time, it can be very difficult for the body to recover, and then you reach a tipping point. Okay. There's other things that I do with my clients, like detoxification, like natural detoxification support, working on the liver, working on the gallbladder, getting that bile to flow appropriately. That's a little bit too much to chew off in this kind of setting. But I want you to know that for most people, if you hit those things with the knowledge I just gave you, it will be helpful. For some of you, if we need to go deeper into your health condition, if these things are not enough to get you to where you want to go, please feel free to reach out to me, info@drpatriciamills.com. We can schedule a discovery call and figure out how it is that I can help you, or reach out to a holistic doctor or naturopath or someone who has this understanding. It's not just me, like there's a lot of us out there. I have my unique approach, and my method really works. I really love working with my clients. However, what I want you to know is that you need to expand your circle of care beyond your family doctor, because this is not taught in medical school. I can tell you that. I went through medical school, I went through specialist training. At no point in time was I exposed to this information. So it's beyond that level of training. It's in the world of holistic functional medicine, all that kind of stuff. And this is where I hang out. So please feel free to reach out if you have any questions. I really hope that you found this of value. I must have done a really amazing job, because I can see that there are viewers and there's no questions coming through. So thank you, ladies, for joining me. I hope you have a really wonderful rest of your day, evening, or night, depending on when you catch this. And I'll be talking to you soon. Bye. Mwah.